Greetings everyone and welcome back to my channel. I am Dr. Noor Mustafa, a physical therapist. Today we are going to talk about the second learning method in medical terminologies. In our last lecture, we learned how medical terminologies provides a universal language for healthcare, making our communication more precise, professional, and patient-centered. We also explored the linguistic roots, prefixes, suffixes, and roots that help us build and understand complex medical words easily. Remember, mastering medical communication isn't just about memorizing terms, it's about connecting meaningfully with patients, peers, and the entire healthcare team. So, let's begin with our today's topic. Today we are going to discuss about the second learning method, which is discovering patterns. Discovering patterns in medical terminologies means identifying the repeated structures like roots, prefixes, and suffixes that appear across different medical words. By recognizing these patterns, we can understand the meaning, pronunciation, and structure of unfamiliar terms without memorizing each one individually. In simple words, it's a process of finding irregular rules or similarities in how medical words are built and what they mean. In discovering patterns, when we learn about the word stress, it is a vital part of pronunciation of medical terminology and can be challenging. Stress often moves in a word when a suffix is added, and suffix is added at the last of the word or after root. To apply the discovery approach to learning what word stress, you can first identify the stress for words that share the same roots and then notice the patterns of stress positions. Discovering such patterns helps in decoding, learning, and remembering complex medical languages more easily. So, the first one is these are the different examples of discovering patterns that you can see on the screen is first one is cartilage, second one is abdomen, carcinogen, psych, ovary, anti-cartilaginous, abdominal, carcinogenic, psychological, ovarian, anterior, physics, meninges, pleura, mammogram, laparoscope, otoscopy, physician, meningitis, pleuritis, mammography, laparoscopy, and otosclerosis. In the first word cartilage, the word cartilage is the one on which stress is applied. Same like abdomen, carcinogen, and psych, and so on. So these are the examples you can see on your screen. The first one, if the word and or the terminology ends with the different words, like you can see Ike, ein, Ike, Ike, Ian, I'll, Ines, Einel, Ire, Eint, Eichel, UL, US, I am, ity, erin, eras, and ns. When these suffixes are added, the primary stress is typically placed on the penultimate syllable before these suffixes. What is penultimate syllable? It is the second last vowel word. Okay, so the example given is pediatric, gestation, residual, hypoxemia. In second group, when we add suffixes like scopy, logi, ectomy, pathy, plasty, magali, graphy, raphy, trispy, trophy, and tommy, the primary stress is typically placed on the antepenultimate syllable. Antepenultimate syllable mean the third last suffix vowel word of the word. These includes syllables before the y like hepatomegaly, leproscopy, biology, tracheotomy. In the C group, if the root words or the medical terminology end with the suffixes like itis, isis, or osis, the stress is basically placed on the first vowel in the suffix, like bursitis, scoliosis, and amniocentesis. Why pattern discovery matters? Because it enhances your clinical communication, aids you in learning faster, reduced errors in documentation and diagnosis, help decode new or rare medical terms intuitively. There are three tips I am going to give you to recognize pattern. The first one is multiple roots that indicate multiple structures in the medical terminology. For example, osteoarthritis, which is bone and joint inflammation. Second one is combining vowels. Usually O is used to combine the words, which makes the term easier, like neurology. And the last one is same suffix or prefix can apply to many systems, like itis, like it is always signals, itis always signals inflammation. So that brings us to the end of our discussion on discovery patterns. Thank you so much for watching. If you found this lecture helpful, please give it a thumbs up, subscribe to my channel, and share it with your colleagues and students. You can also leave your questions or topics you would like me to cover next in the comments below. Until next time, take care, keep learning, and keep communicating with your clarity and compassion.